I've been in healthcare for probably far too long to remember now, and some people may recognise me from a youthful lad. But more and more now we're getting asked the question, how do we start to achieve the stringent targets of net zero, achieving the green plan and removing plastics? I can't answer those questions accurately, so what better way to do that than to get a team of experts in to help you guys answer these, get answers to those questions and help us drive forward. And I'm very pleased to say today we've got a great panel of experts that are going to give you exciting talks, interesting talks, and very, very informative. Throughout the webinar, there is the opportunity to ask questions in the chat box, and we will have a Q&A session at the end where we'll try and get through as many of the questions as we can. If you put your question into the chat box, my colleagues here will make a note of it and I'll ask the question as we go through. So if you can put on there your name and your healthcare and where you're from and who you'd like to ask the question to, I shall do that for you at the end. So without much further ado, I'm going to hand you over to our first speaker today, to Martin Toomey. And please enjoy any questions, chat. As I say, please put them into the chat box, your comments as we go, conversations between yourself. It'll be good to see your reactions as we're going on as well. So thank you, Martin, over to you.
Thanks, Adam. Good afternoon, everybody. I'm Martin Toomey. I'm Sustainability Manager at NHS Supply Chain. Try and get my slideshow going.
Just as a point of interest, we do have a couple of speakers live in the studio with us, and we are dealing via Teams, and so there could be one or two communications issues. Obviously, being about sustainability, we didn't want to get everybody flying over to Belfast because we want to maintain a low carbon footprint. So we have got speakers online. If they are about to speak, if they can remember to unmute their microphones.
Can you see my?
But part of the challenges we see in the marketplace are, how do we start reducing plastics? How do we move away from that? Interestingly, I saw a piece written recently about the first carbon neutral operation that was carried out in Birmingham, and I saw the people that had written the piece, and my first question to them was, what did you do with the syringe barrels? What did you do with the packaging from the drapes? What did you do with all of these aspects? Where did you put the waste? Where did you put the clinical waste? And it was almost as though I was asking them a question in Greek, because the actual puzzled faces was quite a concern. So they were looking at various aspects of carbon neutral, but a lot of the actual single-use waste wasn't being addressed. And I know I've worked with Anne, one of the speakers today, and we've spoken about this for quite a long time now, and it's something she's highly passionate about, and she'll share that passion with you when she speaks. I'm just waiting to get the nod from the technical guys to see if we're getting anywhere through, so you're having to put up with me and a bit of waffle at the moment.
Can you not hear me at all?
But Martin, we're handing over to you. We can't hear you at the moment. I'm not sure. It doesn't look to be that you're muted, but we can't hear your voice coming through, albeit we can see your presentation fine.
I can hear it.
So I think we are about to be able to hand over to Martin. So apologies for the delay, and looking forward to Martin and his presentation.
I don't know what's happened.
Yes, we have success. So
you can hear me.
Martin.
Right, I'll share again. Can you see the presentation?
Yes. Yes, we can.
Okay, thank you. So I'm Martin Toomey. I'm Sustainability Manager at NHS Supply Chain. I just wanted to sort of give you the recent developments around sustainability in the NHS. We developed our current strategy back in 2019, late in the autumn, and it was then signed off by our board in 2020, and then obviously changed for a couple of years. Then the NHS published their net zero action plan back in October 2020, which put the ambition of being a net zero healthcare system by 2045. Just a note that being net zero by 2045 means our suppliers and our supply chain. And during last financial year, 98% of our carbon emissions as an organisation was with our suppliers and our products that you supply to us. So that's interesting, isn't it? Just going down to the other point, the NHS have developed a supply roadmap, and this gives us key dates and key initiatives around getting to carbon neutrality. So I'll talk later about a couple of policy notes that the government published. So our focus areas in NHS supply chain is obviously tackling climate change. I think that's the one that we're all talking about today, but it's a reduction of single-use plastics. It's that circular economy, you know, reuse, remanufacture, refurbish. Very passionate about labour standards and modern slavery. We've got global supply chains, and obviously some of the markets that we deal with, labour standards might not be as good as the UK. 10% social value is a requirement now in all our procurement, so that's added value. So 10% of the weighting of any agreement would be down to social value. We have projects around value-based procurement. I think that's in the introduction. We talked about adding value to the patient sort of pathway, and this is about not just looking at the product or service that we supply, but how we can get value out of the whole procedure, you know, either saving days in hospital or saving the need to go to hospital or saving the number of procedures someone has to go through, to add value into the system, and also look at sustainable value as well. And another big thing that we've got as an organisation is we need visibility in our supply chain. So we need to see down the tiers to understand where the potential risks are or the potential bottlenecks, because obviously at the moment you will all know that resilience and supply chain resilience is being tested to its limit, and you know, shortages and delays in services are happening all the time. So as we did our strategy, we looked at what was important at the time for us as an organisation, and that's where we came up with our 4 key themes. And but everything on here we have to consider. So it's not just about the 4 key themes. It's about this, you know, the protecting the environment, about food standards, about animal welfare. You know, it's everything. Water, stress. So we introduced our 4 key pillars before. Human rights and labour standards, that's important to us. We have a programme of activity around that. Waste and circular economy, we're continually looking for projects to have that ability to be circular. So the latest one we're looking at is walking aids for daily living. So, you know, your crutches, your frames, how we get them back into the system. Because at the moment, you know, they are seen as single use, and there's pockets of refurbishment. We want to see that on a national level. Plastic packaging and plastic products is a big one for us. Obviously, single use plastics, I think Paul may talk about that in detail in his presentation, but the amount of plastics that we put into the market in the recent years is just horrendous. So we've got a dedicated programme of looking at reducing plastics. And the big one, like I said, for us is the carbon emissions, the greenhouse gases. How do we get, you know, 98% of our emissions out of our supply chain? That's the biggest question and challenge to you guys to think about during the course of this event and afterwards. I talked about alignment. We're aligned to our key stakeholder, which is NHS England, the roadmap and the themes of that roadmap. And we continue to attend various meetings, external, internal meetings in terms of the NHS, and we have in our own organisation employee groups around how, as a business, we can become more carbon neutral and more sustainable within our IC infrastructure, and the sort of voice of our customer coming back into it to say what they would like to see around sustainability. I think that's the end of the presentation. I'll come back in if that's okay.
Excellent, thank you, Martin, and some really, really interesting points there. As I said earlier on, if you've got any questions, then if you want to type them into the chat box, if we get a chance at the end, we'll address them. If not, I'll pass them on to the speakers and get the answers for you. We've got a slight change in the running order, and Paul is sitting there poised now. He's actually going to jump in because Jade is not with us yet. So thank you, Martin. I'm now going to hand over to Paul Chivers and let Paul carry on. Thank you.
Thank you, Andy. Thank you, Martin. I will just get my slides up. Right, can you see those?
Yes. Yeah.
Cool. Okay, so yeah, Paul Chivers, I head up the PPE Innovation and Sustainability team in SCCL. We moved over in April from the Department of Health and Social Care. We're a fairly small team, and what I'm going to run through today is a bit of the background about who we are and why we were formed, some of our achievements and challenges that we have met, overcome, and some still to overcome, and then I'll see if there's any questions and answers. So the background to who we are. Back in 2020, there was a deep dive undertaken for Emily Lawson. She was the Chief Operating Officer at the time for the NHS, and the deep dive revealed that there were a number of issues in terms of why there were no new innovators, there were no new organisations coming in to provide PPE and products into health and care. Some of those problems were 4-year contracts. Some of them were confusion over the regulatory process. Some of those things as well were about there wasn't a point of contact to go to. You can't go to the MHRA or the Health and Safety Exec really and get advice because they regulate you. They're there to do the regulation. So people were frustrated. If they did have a good idea or a good product, they couldn't get in. Then, as Martin touched on, PPE strategy about more resilience, more onshoring or nearshore, and to reduce the amount of environmental damage through shipping and transportation around the world. The NHS Net Zero, again, Martin's touched on that as well. So that was brought to the fore. And so therefore, in 2020, the RIS team was formed. So what have we achieved? It's a fairly small team. It started off at 6 and has recently reduced to 2 plus myself. So in that short time, as I say, we've been in existence now for about 2 years. In August, we launched the Glove Reduction MOOC. A MOOC is a massive open online course. It is available to everybody in health, social care, independent sector, and we've even got some people who have logged into it from Hungary and Australia. It's a 1 hour education and information and awareness based on some work that Great Ormond Street did about 4 years ago, where they took on a challenge to reduce inappropriate use of single-use gloves. And they achieved a 33% reduction, which is quite significant. Gloves are seen as one of the largest contributors to the environmental damage. So what we've done here is we've looked at if we actually managed to get all users of gloves across the health and social care that we've been supplying whilst this pandemic's been on, even if they achieved a 15% reduction, there's a £24 million saving in procurement, but there's a 27,300 tonnes reduction in the carbon and a 4,700 reduction in waste at a cost of 1.4 million. And this is year on year. These gloves are being used inappropriately time and time again. Similarly, we're trialling and we're piloting a glove dispenser. It guarantees 1 glove cuff first each time. So many of you will have experienced and seen, you reach for a glove, lots of gloves fall out and they're all over the floor and they go into the waste. We want to demonstrate that actually those types of dispensers do generate a 10% reduction in waste, as well as trying to encourage more dispensers to be created. There is only one company at the moment in the world that we know of that does this. I've suggested there must be other ways of doing it as well. Go to a cash point, and you very, very rarely do you get more than your one note or however many notes you've asked for. So there's got to be a way of only guaranteeing one glove comes out. Similarly, when the Mr. Lottery does the lottery balls, they guarantee only one ball comes out. So we must have the skill and the ability to actually build better dispensers than the cardboard boxes that we see that get torn, plus they're open to the elements. The new dispenser, like I say, cuff first, it is gravity fed, so you put it down and therefore you can't breathe, cough into it. The link that you see underlined there is a link to that course. As I say, anybody can log into it. If there are any problems, Mr. Caddick is my man who will sort out your problems for logging in and access. Moving on then, so there aren't many things we can reduce. So then we've looked at reusables. We currently have on pilot a reusable Type 2R mask. That will take out a significant chunk of single-use plastics. We're in week 8 of the 13 weeks. It has been a slow process. One of the learnings is it takes a lot longer than we anticipated. We had to make sure the product, which is an innovative product, was compliant, met the health and safety, met the essential health and safety regulations, as well as the standards for a Type 2R mask. So that will come to a conclusion, hopefully the end of October, first week in November. As I say, that will reduce a significant number of single-use masks. Community, we're also doing a community pilot with them because the pilot that we're doing at the acute has got an on-site laundry. Not everybody, and a lot of community settings, wouldn't have access to a compliant laundry. So one of the things we're looking at being able to do is have a blueprint that says you can find a laundry that's nearby through Textile Services Association or others, and as long as it doesn't need massive capital investment, but it only needs process, quality management, etc., you can probably stand up a compliant laundry that will launder to HTM 0104 standards. We're also looking at reusable eye protection. Now, there is already reusable eye protection out there. People will tell me, you know, why does it take so long to get these products? The reusable eye protection that is currently on the market, as with many products, is made and designed for heavy industry, construction, etc. It's not for healthcare workers. So what we're having one designed and made for health and care workers, because, and that was the company themselves suggested it, because every time we took their product and went anywhere, they're very nice. They've got little nooks and crannies in them though, and they've got places where debris will build up, and they're difficult to clean. They're not all that comfortable. As I say, they are made for your average white 5'11" male on a building site. These new ones won't be. We're also looking at decontamination catalogue and processes and products. Most ways of cleaning now, there's the washer disinfector, there's an autoclave, there's moist heat treatment, and there's the good old wet wipe, of which I think we spend somewhere in the region of £23 million a year on piles and piles of wet wipes. If we go to more reusable products, what I don't want is a mountain of wet wipes sat next to them. So we're looking at things like ozone cabinets, UVC cabinets, hypochlorous acid and gassing generators, and then using the hypochlorous acid spray with a cloth to be able to safely decontaminate. And also the recycle part of it that Martin touched on as well. At the end of their life, when we're talking to manufacturers now, we're suggesting they take the product away after it's 40 washes in the case of the masks, and they are either made into things like blackout curtains and donated to deprived areas. They may be made into mattress covers for homeless, and they also can be shredded and made back into other materials. Same with the reusable eye protection. They'll be taken away post their 2 years or X numbers of reprocessing. So potential benefits of those. We looked at the benefits of the glove reduction. If we move to more reusable products, the Type 2R, if all users of Type 2Rs at the moment, and we moved 80% of them to the reusable mask, we would save 11,500 tonnes of carbon and a waste saving of £1.5 million year on year. If you go to pre-COVID levels just in health, that's 3,600 tonnes and nearly £500,000 year on year. Single-use aprons, again, aprons and gloves go hand in hand. Some nurses referred to them the other day as it's a marriage. You pick up one, you get the other. If we reduce inappropriate use of gloves, we will probably reduce inappropriate use of aprons. As well as that, we can move to reusable aprons. And through moving to reusable aprons, we would also see those savings and reductions shown there. Visors, similar theme, massive plastic, heavy carbon footprint, and again, moving to reusable eye protection for all users or pre-COVID levels. There's still significant reductions in carbon and savings in waste. So what are the challenges to achieving this? Before we can put any of these products into a pilot, we have to get them confirmed as being regulatory and compliant with the EHSR of either the MHRA or the Health and Safety Executive. That comes at a cost. They need to be independent as well, so there's no sort of bias towards any organisation, and there's a capacity issue. We were lucky. We had the technical regulatory authority that was doing the testing for us with the reusable Type 2R mask. That's now been stood down. We are currently reliant on surgical materials testing laboratory, but there's a budget and a need to have access to that independence going forwards. Funding, again, we are a temporary team unfunded, and we need to buy products to put into these pilots. So for long-term movement to sustainable products, obviously there needs to be an allocation of funding. We've also met challenges in terms of, I spoke about the ozone cabinets, I spoke about the UVC cabinets, and this plays into another bullet point further down. Current standards for products on a building site, like eye protection and like the reusable P3 masks to move away from FFP3s, have no cleanliness level. It doesn't tell you how clean a product needs to be, and therefore we're at the mercy of manufacturers advising how clean it should be. And that can range from anything from like run a visor under a tap and air dry it, i.e. hang it on a clothesline. We don't have too many of those in hospitals, to being cleaned with very strong wet wipes, which damage maybe the seals around the eye protection and things. So what we're trying to get to is a point that says actually that eye protection needs to be clean to this level, and a P3 mask would need to be clean to this level, in the same way the reusable Type 2R has to meet the microbial cleanliness level of EN 14683. So we could therefore agree the levels, and that would then give the manufacturers the known challenge that they could then identify the appropriate products and processes to bring those products back. Education and behavioural changes for staff to go to reusables. 40, 50 years ago in the NHS, reusables were probably commonplace. These days it's disposable. To ask somebody to put a mask on that somebody else wore a couple of days ago, there are some people that go, yep, that's fine, I know it's been through a good process. There are some people that say, over my dead body, and there are some people that you can probably persuade. So we do need to educate and also bring about behavioural change, and also the reusable products have to be put into the appropriate receptacle, and that then leads into the logistics that we'll come on to in a moment as well. The infrastructure to safely manage sustainable products. So we've worked with the MHRA. We're using RFID tags in the masks, so they're scanned every time they're laundered, and therefore we know when it gets to the 40 washes. We have got a number of RFID systems, but it's the licensing to have them on the site and to have that rolled out widely so that we can then track things like reusable theatre caps, reusable aprons, reusable gowns, reusable masks, drapes, privacy curtains. All of those things could be tracked through the same system. Things like compliant laundry is also a requirement to ensure that people aren't just using any laundry. Reusable Type 2R masks cannot be home laundered. Going back to, like we were talking about, the evidence for the efficacy of cleaning, we could therefore create health and care specifications and standards rather than using existing building the standards for construction, etc. Eye protection can currently only be built and made in 2 sizes because that's what the standard says. However, we have a very diverse culture. We have a very a huge array of different sizes and shapes, heads, etc. And therefore, perhaps we don't want to be hamstrung with just 2 different sizes. Also, once we've done the pilots, then we have to find the BAU owner. Who wants to own the MOOC going forward to make sure that the information on it is up to date, and to update it, and to also engage with users and to run sort of concurrent sessions. Improved communication across all organisations. This is again, we know we've got RFID tagging systems. A lot of people probably don't, and they might go and buy their own. People don't know what products have been piloted and tested. They might go and try their own. So through our monthly innovation hub, we try to share our knowledge and information. But again, it's an area that we know could be improved significantly. Improved networks as well to focus on some of these challenges. I have a small team of 2, and it is about pulling together with other people like some Martin's team and other people in Greener NHS to try and tackle some of these challenges. And finally, there's the waste rules and regulations. There is the fact that not everything, just because it came out of a healthcare setting, is healthcare waste. And I know there are some discussions, and Anne may touch on it later as well. You know, privacy curtains may never have been in contact with a patient, but it might be seen as healthcare waste. If we can try and break that everything coming out the door needs to be treated in a certain way, we could potentially reduce the cost and the dealing of that waste. Thank you all. That concludes my presentation. If there are any questions either now or later, happy to answer them.
Excellent. Thank you very much indeed, Paul. Some fantastic points there. Interesting looking at that correlation between a change away from single use and regulating how many things you're using to a significant cost saving, helping with other pressures that the NHS and other healthcare facilities are dealing with at the present time. So thank you. Quite a few questions coming through in the chat box, so please keep them coming. But we're still waiting on one speaker. So I'm going to now hand across to a lady I've known for a few years. It's my pleasure to introduce Anne Woolridge.
Thank you. Can you see my screen?
Yes. Yeah.
Yeah, and it does say the importance of waste strategy and policy for healthcare, hopefully.
Yes.
All with a relief. Right, thank you very much for inviting me to speak today. Nice that Paul ended on waste, and I am going to probably throw a few challenges out there today for you, because while I work in waste, and most people know me for waste, I actually don't want waste. I want us to actually move away from waste. So let's start with the legal definition. So the legal definition, and this is where it's quite a challenge really, any substance or object the holder discards, i.e. throwing away, intends to discard or is required to discard. And there's a big piece of work around at the moment around things that are in date and what are dates and is it expired and do we need to get rid of it? So keep that definition in mind, because our ultimate aim is to get stuff to not be waste. When it is waste, we have to correctly classify it. What is it? Is it a privacy curtain? We'll sort that out later, but maybe not today. Is it a Coke bottle? Is it other brands are available? Is it a pharmaceutically contaminated sharp? Is it packaging? What is it? So once I've decided what it is, once I've classified it, I then have to correctly segregate it. Once I've segregated it, I need to store it correctly. And then I need to dispose of it with the correct permits, correct documentation, need to make sure people have got the right licenses. It's a really heavy regulated area. And I'm only touching on the waste on sites at the moment. I'm not going to touch transport at all today, but we're regulated in England by the Environment Agency, in Scotland by SEPA, in Wales by Natural Resources Wales, in Northern Ireland by NIEA. So we're highly regulated. And the other people that are interested in this are not only the NHS, as we have data, but we also have the Care Quality Commission. They also want to ensure that any waste that is generated is correctly classified, segregated, stored, disposed of correctly. Just going to give a bit of context here. I'm going to spend a couple of minutes on this, but I think it's really important. The NHS's budget is around £159 billion. We have an extra 22.4 billion allocated for COVID. Those numbers are huge, right? 1.5 million employees to train. Thank you for the MOOC, Paul. It really is starting to make a difference. We've got to correctly train all these people to manage their waste. 1.5 million people to correctly do this. Diverting slightly, the NHS spends about £9.2 billion a year on prescriptions, of which we know somewhere between 10, but probably nearer 30% are not used. So potentially we're wasting £3 billion a year of pharmaceuticals. And I'm fairly confident in my figures because part of my research was in pharmaceutical waste. Bringing that back to the reality of waste. The NHS now, and I'm talking England only at the moment, but we spend about £120 million per annum on waste. This is why we cannot get waste onto the chief exec's desk, because it is less than 0.1% of the NHS's budget. So we've been looking at what Paul's been talking about, we've been looking at what Martin's been talking about, and these are huge numbers. We come to actually getting rid of waste. The environmental cost is phenomenal. We look at the financial cost, and suddenly you're at 0.075% of the NHS's budget. There are a lot of people, including me, that are passionate about getting the NHS to reduce their waste, passionate about the environment. But if I'm competing with pharmaceuticals, how am I going to get interest in that? And thank you for the lady that commented. She's been working in ICU for years on this. I know I've been doing this for 20 something years now. Some days I feel like we're stuck. Other days I'm like, we're getting there. We need to save money. We need to make sure our waste is well managed. And to be honest, what we do produce, I'm not sure we pay the market enough, but that's a whole separate argument. Hopefully Martin will like this slide. The NHS in England is the first health system to embed net zero carbon into legislation. So thank you for that. We also have an encouragement to split our waste 60% non-hazardous offensive waste, 20% infectious waste that needs treatment, and 20% incineration only waste. And of those, we're going to like our pharmaceutical sharps, our cytos, anatomical things. What I'm going to do is challenge people to go, net zero carbon's great, but let's not make it through waste. Let's not have that waste. So we need to do this by not generating waste in the first place. And that might be using devices that don't generate waste. It might be changing process, because one of the things we have to comply with is the waste hierarchy. And the waste hierarchy says, prevent waste. Use devices that don't create an extra waste. Let's use devices that are reusable. Let's look at remanufacture. There's all sorts of things we can do. Currently, we've got a few legislative challenges where the answer is no, because it says it's single use. We've got a challenge. This is one planet. So we have to make sure that we apply the waste hierarchy so we don't generate waste. If we do generate waste, let's plan to reuse it, either in its current form or a different form through recycling. Worst case, we start to go for energy recovery. Then we look at energy incineration without recovery, and finally landfill. I am going to throw this out there. A well-run landfill is actually better than a poorly run incinerator. So we need to be a little bit careful around landfill is a demon. It's not always. Sometimes it's a very safe place for things to go. Mid-range incinerators that have no energy recovery, I'm not a massive fan. So take this with a pinch of salt, but what we have to do is not negatively impact our environment. Is the focus wrong? We're focusing on waste and single use. And I think Paul's already, Paul's preempted a lot of this. We need to look at reusables. We need to look at things that can be decontaminated. We should be striving for no use. Do I actually need this? And again, coming back to the crutches, do I need this? Do I need this air boot? Would somebody else use this air boot if it were to be decontaminated and sent round again? Because at the moment, all I do is find them in bins. Can we reuse with minimal processing? Can we decontaminate? Can we start to look at innovation for decontamination? There is also a massive debate around biodegradable compostables, etc. But that's a whole separate seminar, probably not to do it today. But in terms of healthcare and healthcare waste, surely our best thing that we could be doing is to promote wellness and illness prevention. And then our pharmaceutical waste goes away, or a lot of it. A lot of our single-use plastics go away. So I am really throwing out a challenge. Yes, I work in waste. Without waste, I wouldn't have a career. But I also want to see well people that aren't engaging with our health system. There is official guidance out there because my talk is about strategy and policy. The NHS does have a strategy. It does have policies. We have guidance as to how to manage that waste that is created. And what we need to do with that is to make sure it is accurately transposed into local policy. What we don't want to see is that situation where We've always done it this way. Oh, my local recycling plant's too far away. Oh, they haven't got a permit. Oh, it's a bit hard. If I put that bait in the right place, somebody might make a mistake. I can't put domestic in my ward because somebody might put a glove in it. Train people not to put a glove in it. We need recycling in the places where we can capture recycling. We need general and domestic waste to catch that ubiquitous banana skin, which I'm sure everybody's found everywhere. But we need to make sure that we get this right through strategy, through national policy and through local policy. And again, Wales, Northern Ireland and Scotland also have policy. So we need to work within that. Here's a little table because I know this is being recorded. So we have what the colours mean. We have yellow, which says, I need to be incinerated. That uses quite a lot of energy. Or maybe there are some companies now starting to go, incineration expensive. Let's see if we can treat it. So we're starting to get more permitted facilities. Some things like cytos and anatomical waste we've accepted, they'll always be incinerated. Our offensive waste, 60% may go to energy waste, may go to landfill. Our orange stream, our infectious waste, can go for alternative treatment at a relatively low temperature, so it gets autoclaved or microwaved or some other process, and then gets sent to energy from waste. So we're recovering that embedded energy within that embedded resource within our wastes. Just quickly, because I find this slide horrific, and that is me in PPE. And this is also, for anybody that knows, they're all free. This was in the middle of the pandemic, and they'd even put a mask on those beautiful statues outside. So the NHS supplied 11.7 billion pieces through just 2020-21, compared with our normal 2.3 billion. That was 7 billion gloves, 1.6 billion aprons, 73 million clinical waste bags, 1.8 billion type 2R masks. You know, look at these numbers. Before the pandemic, we were producing somewhere between 213 and 220 tonnes of clinical waste a day. We broke the system. So we were producing 630 tonnes of clinical waste per day, of which some of it was crates of, I can't even put the photos on, some of it was crates of oranges, it was crates of donated stuff, it was food, it was clean packaging, it was clothing, it was drapes, it was scrubs, it was all sorts of things, because we didn't understand. We cannot let that happen again. We've got to be better in the future. So let's challenge custom and practice. The curtains is a classic example. I'm not going to follow up on it today, but if anybody wants to talk to me about curtains not being clinical waste or not being healthcare waste, please contact me. We need to train for behaviour change. We need to not buy it in the first place. Because one of the things I get is like, if we've got a new consultant, he doesn't do it that way, he does it this way, or she doesn't do it that way. So all the stuff that the previous consultant has now moved to another hospital that's going to buy, we've got waste in the previous hospital. Look at reuse, look at remanufacture, repair items, donate it. So all I'm doing here is applying the waste hierarchy. Work with academics, work with product users, work with suppliers to try to develop environmentally sustainable products. I will now draw a breath. As you can tell, I'm quite passionate about this. Thank you very much for your time. And if you've got any questions, again, I'll either answer them now or at the end.
Excellent. Thank you very much indeed, Anne. And yes, as you say, draw breath, but you can see Anne's passion and the common sense attitude and everything that's coming out there. And the message that that Anne's promoting is from the past. It's not just recent. And I know has been, I'm going to use the phrase banging the drum, but really been passionate and driving this for many, many years. So thank you very much indeed. We're still waiting on Jade, but doesn't look like she's going to appear. But so I'm going to move on to our next speaker now. And we have in the office, actually, Pamela Johnston, who is going to speak about how her hospital managed to transition to a non-waste generating product. So Pamela, if you're ready to come across, please come and join us.
Pamela Johnston. I am former deputy theatre sister in the Mater Hospital. I have been working in NHS for 35 years and have also done periods of work abroad. During COVID, I was redeployed to A&E research and to the Nightingale ICU. At present, I am working part-time in a private hospital in Belfast. The reason why we switched to the Trimedica monitor was because of its ease of use and it being very accurate. We're having problems with previous thermometers we were using at the time, where we didn't get an accurate fit in the ear whenever the patient was lying flat on a bulky pillow or under surgical drapes during anaesthetic. So that resulted in taking multiple attempts at taking the temperature, which could have left the patient with quite sore red ears, or multiple plastic probe covers being used at the one time. At the time that the Trimedica came into our hospital, it was a time that we were trying to introduce cost-cutting measures in theatres by reducing clinical waste. We also, as we're talking there, it is quite substantially more expensive to dispose of the orange clinical waste bag. So we were trying to cut that down to 2 per theatre at the time. Also at the time, there was a talk about global warming with the Blue Planet programme by David Attenborough and Greta Thunberg. That was also brought home to me by my daughter, who was going downtown with her placard to protest about climate change. So not only were we then just looking at cost cutting by reducing clinical waste, we were looking at segregating waste, and we had posters above each bin what was to go in there, and also on the bin top. One of the nurses at the time also had photocopied pictures of Greta looking very cross with statements about global change over certain bins, and there was a few of us who were called the bin police because we would be shouting wrong bin whenever somebody was trying to put the banana skin into the clinical waste bin or the sharps box. So that a lot of education on reduction and segregating of waste, and also trying to reduce the amount of single-use plastic that we were using at the time in theatre and find other sustainable alternatives that did not need any disposable parts. Again, the Tri-Temp thermometer, it was good. It met this brief because it didn't have any disposable ear probes. So it was just the same point in use. There was a lot of talk there about Greener NHS, which Paul went on about, and I was actually very interested about it because I actually was one of those theatre nurses 40 years ago who was using laundered theatre drapes and laundered gowns. So we are hoping, the NHS is planning to go net zero by 2045, and that is what it's looking at, is about introducing technologies and innovations which are reusable and don't use single-use plastic. For us, the Tri-Temp was one of those items that met that brief and helped our goal towards going greener. Okay, thank you.
I will stay there. I'm wondering if there's any questions. So I shall assume the role in the middle here. So thank you very much. We're going to give a virtual round of applause to our speakers, but we're going to do it live here. So thank you, guys. Apologies to call you speaker experts, I think, and what you guys have put across today is really, really pertinent. We've got about 10 or 11 minutes, and I'd like to take some questions that have come through. I'll direct them in the right place, if I may. And to start with, one of the first ones that came through. Echo. Somebody need muting, or no? Maybe I need muting. I'm sure that has been said before. But the first question. Excellent. So Thank you very much indeed. My colleague does have the questions. He's collated actually as we've gone through. So the first question that came through is, why is innovation and the move to reusable, sustainable products so slow? There are a lot of sustainable products on the market. Why is adoption slow? And I think, Paul, I think you're probably the man to take that one on. Did you hear the question okay?
I did, yes. Thanks, Andy.
Thank you.
Yeah, it's even the Royal College of Nursing, Rose Gallagher, for those of you who know, she sort of said, you know, there's a frustration that this innovation is so slow. Why? And there are a number of contributing factors. Yes, there are a lot of reusable, sustainable products out there. They may not all be compliant, is the first issue. So we do need to check. I'm also working on transparent face masks. We now have 7 of those that are compliant, but the number of the ones that got rejected because they weren't, they would claim they are, but then when they had a detailed review and assessment, they aren't. So we can't run the risk of taking a product and putting it into a use and putting it on a care worker or a health worker if it's not fully compliant. And similarly, it may be sustainable reusable. It's got to go through a certain reprocessing. So HTM 0104, it's 68 degrees for 10 minutes, 71 degrees for 3 minutes. A lot of products don't do that. They go through your home laundry at 30 degrees. So to get the right product, to get it approved and get it accepted, I think I saw a question about IPC. We need to get national IPC to support us in the pilots as well. And then the local engagement, it is slow, but unfortunately we need to be safe as well. If we get it wrong, we will be going back a number of years before we can start again. So we don't want to make mistakes, we don't want to rush into it, and we want to make sure we get a good product, a safe product that can be safely reprocessed. And also the reprocessing needs to also be environmentally friendly.
Exactly right, and that's a comment thread that I noticed coming through about the reprocessing aspects, and I know a lot of the washer disinfector companies are really taking this on board now. So thank you for that, Paul. I think this actually has slightly been alluded to, but we had Donna Hepworth. She's had to leave to deal with an issue, but she was asking about the IPC contribution to the reusable initiative. I'd like to actually take that beyond reusable to non-waste generating initiative if possible. So are you able to go on that one, Paul, again, or you did allude to the IPC there?
Yeah, so we have good links. So I meet with the National IPC's technical expert. So she's a microbiologist, but not a nurse by background, and also the 4 Nations IPC leads and IPC reps to run past them any barking mad ideas I might have about a sustainable reusable product to make sure that it's viable in the first instance, or if they pull some faces, what the challenge is. So we do work with them quite closely. I know a lot of people will say they're anti reusable and sustainables. They're not. I think if you put a logical, well-reasoned, safe argument to them, we get their buy-in. You know, a powered hood is the one that I always use as an example. Somebody said to me, we'd like to pilot this, and I said, how do you clean it? He said, you can wipe down the outside 200 times. I said, how do you clean the inside? He said, you don't. There's no way am I standing in front of anybody trying to make that argument that you don't need to clean the inside of a powered hood, but just wipe the outside 200 times. So yeah, I know they get a bit of a knocking, but I do think actually if you go with them with a sensible approach, then they are supportive.
I think, you know, I totally agree there. And I think, you know, it comes down to accurate IFUs when they're going out to people, ensuring that the cleaning protocol is actually instilled. And that is part of the training, because just to talk about my experience in the past, I've seen people where they train how to use a device, but they don't actually train on how to maintain, keep it clean and restore it. And correct cleaning reduces obviously the amount of times it needs to be repaired. So thank you very much indeed. We had a question from Greta from Friendly Health, and she was asking, how do we calculate and record footprint reduction? Who wants to take that one? Anne, would you be able to offer some support on that one for Greta?
It's one of those challenging things because it depends where you are, how you're going to transport your stuff. I think the NHS is starting to pull together through the Head of Sustainability and Net Zero department, if you like, that environmental estates and facilities. They're starting to look at trying to get some metrics. Originally, we were looking at some stuff from WRAP, the Waste Resources Action Programme. It's a government-led programme, but it doesn't really reflect the NHS and the way we operate these days. So it doesn't even take into account, for instance, the fact that we use single-use sharps bins or some reusables. It's very hard. There is no number. I can't go alternative treatment is that, incineration is this. It's very difficult, but there are people starting to look at it at a strategic level. So we should be able to get some metrics. Yeah. While I'm speaking, and I was just about to type actually, can I also take Greta's comment on Doxon research looking at spend and footprint on single-use gowns versus reusables? There is a lot of research out against single-use versus reusables for gowns particularly, and in the context of COVID-19.
Yeah.
And a merciless plug really, there's a WHO report called the Global Analysis of Healthcare Waste in the Context of COVID-19. That has also looked at the carbon impact. It's also looked at the impact on healthcare waste from the pandemic. So there's some really good data in there from a set of case studies. So sorry for that plug, but it's a bit of a meaty report, but there's some decent stuff in there.
Excellent.
Could I just chip in as well, Andy? So some of those figures I put in terms of carbon reduction, that is taking into account the fact that the reusable product has been laundered. So if we take a type 2R mask, it's 26 grams carbon footprint of a single use. We only claim 10 grams for the reusable because we know that there is a consumption in terms of the laundry to and from. And similarly, the aprons, again, we have that as 65 grams single use, and we only claim 30 to go to a reusable.
Excellent. Thank you very much. Thanks for the clarification on that. We've probably got time for one more question. I know your time. And Leo Carlson-Beaton asked, what is the future plan for self-generation? Is there going to be investments into nearby renewable generation, or is there going to be funded products for self-generation? I take it that's energy from waste related. Maybe all three of you can come in on that. It's not a field I'm familiar with, so I can't actually give you any contribution on that one. Is it something, Martin, you've got any views on?
Well, I think self-generation, it's talking about how do we be self-sufficient as an organisation. Our two newest warehouses, which are massive, are to BREEAM specification. They have sustainable solutions in them. We've also we are involved in an electric truck trial. We've got 8 electric vehicles in our fleet at the moment. They've just done their 1000th delivery and saved 16 million tonnes of carbon in that process. So the technology has to get there. You know, the government have to invest in putting solar panels on people's houses rather than electric car charging points. The standard, we've got to do that. So as a country, we need to see investment in renewables, and I think see that plan coming into fruition. And also it's adaptation in the NHS themselves as well. How do they go to more renewables?
Yeah, perfect. Excellent. I'm very, very conscious of everybody's time, and we're down to about a minute or so left. What I'd like to do is just thank you all for attending today, especially our experts. Thank you very much indeed. Thank you all for contributing in the chat and actually the questions that you've asked. If we haven't got to a question, I really do apologise. We'll try and take it and put it into a chat somewhere so we can get an answer for you. But moving forward, please give us a review on what you thought about today. Hopefully you've all learned something. Thank you to Pamela, Anne, Martin, Paul. Thank you to the unknown participant who's just exiting, makes me feel really good. And of course, thanks to my colleagues, Julie and Paul, for their intro earlier on. But overall, thank you very much for joining us, and thank you for taking your time out of your day. And I look forward to hopefully meeting some of you in face-to-face in the future. But stay safe, take care, and be sustainable. Thank you very much indeed.
Thank you very much.
Thanks, guys. Take care.